some more about this. The big question is, will Congressman Ryan's budget bring Washington closer to cooperation and fiscal responsibility, or simply make the gridlock even worse? We've got two sides for you. Joining us, Republican Congressman James Lankford. He's a leading member of the House Budget Committee. Also, Democratic Congressman Sander Levin. He's a leading member of the House and Means Committee. So good to have you here with us today. Representative Levin, I'll start with you. What's your biggest complaint with the Paul Ryan budget right now?
Well, I think in a way the atmosphere is better, but I think the proposals may be worse. The Ryan budget, it says repeal health care reform, but that isn't going to happen. What it says is voucherize Medicare, so it means for virtually all citizens in this country now living, they won't have Medicare. He says they'll protect it when he ends it. So I think in many respects he talks about the taxation, and he says it's going down to 25%. That would mean an even bigger tax cut for the very wealthy than was true last time. So again, I think the atmosphere may be better, but the proposals that come forth from him, I think, really are a step backward.
You know, we hear about voucherizing, creating vouchers for Medicare, and so many people, Congressman Lankford, see that as basically destroying Medicare as we know it. But as Paul Ryan points out, we may not have a choice. It may effectively be destroyed if some change doesn't come. Do we need massive overhauls to the Medicare health care program right now?
Every person that looks at the Medicare program sees it's becoming more and more unstable through the process. And when you look at long term on it, our proposal is to try to bring some stability to Medicare. It's not to voucherize it. You can look at all the poll tested numbers there and names, but it's not a voucher. It's what's called premium support. It's very similar to what we already have in Medicare Advantage, where one individual has multiple options that they can choose from, including traditional fee-for-service Medicare. So this is not taking away Medicare as we know it. This is providing more options and more competition. We know if you provide more competition, it does bring down prices. So you can either provide more competition, it brings down prices, or you can just have price controls from the federal government and say this is the highest you can do and squash it down. Right now, this year, we have the highest amount of tax revenue in the history of the country for 2013. They already look at 2014 based on the fiscal cliff negotiations and say that year will be even higher than this year. But we're still almost $1 trillion overspending. So this proposal is a 10-year plan to slow down the growth of government from 5% growth a year to 3.4% growth a year to bring us back into balance over 10 years. That's not a big draconian cut.
Yeah.
That's a proposal to slow down our growth.
Congressman Levin, does it have any shot at getting through? I mean, how is it being received by Democrats right now?
There's no chance. You can say it isn't a voucher. It is a voucher. Essentially what is said to people 55, under 55 is, here's a certain amount of money and you're on your own. It doesn't protect Medicare. It ends it for people under 55.
How would you change that?
So we shouldn't. What?
How would you change that?
By strengthening Medicare, not ending it. What
do you mean by strengthening specifically?
I think we can more income related. I think we can also do better in terms of bringing down the costs. The fee-for-service system has to end. And look, in the last few years, the cost of Medicare has been going down. We're on a downward path in terms of health care costs. That isn't a reason to end Medicare. It's a reason to strengthen it. Yeah, and so Republicans can say it isn't a voucher, but it is. It says to people, here's a certain amount of money, and you're on your own in terms of any additional cost.
When I just asked you whether this had a chance, any chance with Democrats, you said no. Now, were you specifically referring to the Medicare portion of this, or as an entire budget? Is it just a non-starter?
It's a non-starter. It repeals health care reform. Paul Ryan himself said it was a non-starter. So why is it in the budget? We can't accept something that ends health care reform, that voucherizes Medicare, that essentially block grants Medicaid, and essentially says to the states, do it your own way. Half of Medicaid goes for long-term care. We cannot destroy this program. We need to strengthen it, not destroy it.
Okay, hang on one second. Carlos Gutierrez, former Commerce Secretary with us. We just heard from Congressman Levin, it's a non-starter. You were just talking about the political divide in Washington.
Absolutely. I mean, Congressman, just a quick question. The numbers that we look at suggest that in 20 years, 30 years, entitlements are going to overwhelm our budget. We won't be able to deal with them. What do you see down the road? If we don't deal with the entitlements now, then what kind of a society are we going to be, in 20 years from now when it overwhelms just about everything else we do? And the other thing I'll just point out is these are programs that were started in the 60s, so they're not that old. What do we do?
Look, I agree. What we have to do is to strengthen them, not destroy them. Medicare, essentially, under the Ryan budget, would go away over time.
No, that's not true.
Well, it will. It voucherizes it. The present structure, look, you have an age 55. So the assumption is if you're over 55, you have Medicare. If you're under 55, you have something else.
Well, the vouchers are not true. What do you mean it's not true?
Well, if you actually read through the plan, it gives two options. It gives the traditional fee-for-service that's still included, that stays exactly as it is, but it also provides a competitive element. This is very similar to Medicare Advantage, which is very popular with people that are in Medicare currently. They get a chance to choose. Medicare right now says, we're gonna pick everything for you, and we're going to tell you how this is going to work. We see fewer doctors actually taking Medicare because it's continual. The way they do the price controls is cutting back to providers. You allow competition. You allow for more innovation. You have people covered. The perception that suddenly we're going to cut off Medicare and we're not going to have that for the future generations is absolutely not true.
No one's saying suddenly.
No, it's not.
No one's saying suddenly. What we're saying for people under 55,
that's not true.
Essentially, you're going to have younger people who opt out. And as they opt out, what's going to happen is that Medicare, as we now know it, is going to end.
Medicare, as we know it now, ended when the Affordable Care Act passed, and it did a dramatic change to Medicare already. So this perception that you can't make any alterations to Medicare ignores the long-term risk. If you go back 30 years ago, they did a major reform to Social Security. You had all this heated argument about you can't touch Social Security, but what it did is it stabilized it long-term. That's the same issue we're talking about right now. How do we stabilize Medicare long-term so it is sustainable? Otherwise, we get out 20 years from now in panic, and we deal into a...
Senator Levin, in 30 seconds, how do we stabilize it?
You stabilize it by income relating it a bit more. You also drive costs down by ending the fee-for-service system. That's what health care reform is beginning to do. The increased costs of Medicare, those are going down. We're on a path to stabilization. Don't end stabilization by ending it. Well, it doesn't protect it. It ends it over time.
CBO does not agree that it's slowly coming down and we're saving more money and it's stabilizing.
Yes, they do.
If you look at the long-term numbers of CBO, it continues to rise out of control. And unless we get a handle on this now early, we will face a major issue with entitlements long-term.
We're getting a handle, but don't tear it apart.
All right, we're going to have to leave it there, gentlemen.
Don't tear it apart.
Thank you very, very much. Congressman Sander Levin, Republican.